So in this lecture we are going to talk about prostaglandins and other eicosanoids. So what are eicosanoids? Eicosanoids are the derivatives of eicosanoic acid. That means 20 carbon polyunsaturated fatty acid, and the major type is arachidonic acid, and that's why we call them arachidonic acid metabolites. The major type of eicosanoids include prostaglandins, thromboxane, and leukotrienes. The dietary source of arachidonic acid is linoleic acid, which is an omega-6 fatty acid. They are locally acting lipid mediators, and they are not stored in the body, rather they are inducible molecules. A baseline level is always maintained in the body for their role. They have an extremely short half-life and they are very potent molecules. Their main actions include regulation of pain, inflammation, and homeostasis through regulation of vascular tone, platelet aggregation, and gastric mucus secretion. Let us understand how these eicosanoids are synthesized in the body. As you already know that they are all derived from the arachidonic acid. This arachidonic acid actually rests quietly in the membrane phospholipids. So these lipids are present as phospholipid lipids attached to the phosphate group. Specific triggers like cellular injury, which can be caused by mechanical trauma, or it can be caused by ischemia, or chemical signals like thrombin, epinephrine, or release of inflammatory cytokines, triggers and activates the liberator phospholipase A2 enzyme. Phospholipase A2 acts on the phospholipids and causes the release of lipids. As the name suggests, that it will cause the breakdown of the phospholipids. These lipids contain one of the eicosanoids, that is arachidonic acid. A release of arachidonic acid from the membrane phospholipid by the action of phospholipase A2 triggers a chain of reaction. Mainly two enzymes, cyclooxygenase and lipoxygenase, act on this molecule arachidonic acid and converts it into either prostaglandins or leukotrienes. Let's look at the cycle in detail. Cyclooxygenase acts on this arachidonic acid molecule and causes the formation of an endoperoxide, cycloendoperoxide, where there is a 5-membered chain with 2 oxygen is created. You can look at the structure of this molecule. This is actually PGG2. So PGG2 is a cyclic endoperoxide which is formed by the action of cyclooxygenase, and this is an unstable molecule which is immediately converted into PGH2. Then PGH2 is acted upon by an enzyme isomerase, which leads to formation of prostaglandins, which are prostaglandin E2, prostaglandin D2, and prostaglandin F2 alpha. You can look at their structure, that they are all isomers having slight change in their structures. Second enzyme which acts upon the PGH2 is thromboxane synthase, which converts PGH2 into thromboxane A2. And the third enzyme is prostacyclin synthase, which converts it into PGI2. PGI2 has an additional ring, so it becomes a bicyclic structure. Alternatively, the other enzyme which can act is lipooxygenase. Lipooxygenase enzyme is supported by another protein known as FLAP, which is 5-lipooxygenase associated protein. So with the help of FLAP, lipooxygenase converts arachidonic into 5-hydroperoxy eicosanoic acid. 5-HPETE is again unstable molecule, and it is converted into leukotriene A4, which is a straight chain molecule, which is converted into the straight chain molecules LTB4, LTC4, D4 and E4. So arachidonic acid is a common precursor for prostaglandins, thromboxane, prostacyclin and leukotrienes. Overall, this enzyme cyclooxygenase plays a very important role in the body. This enzyme cyclooxygenase has two subtypes, COX-1 and COX-2. While COX-1 is a constitutive enzyme and has more of a housekeeping role, that means it synthesizes the baseline level of eicosanoids in your body as and when required for mainly physiological role. Whereas COX-2 is an inducible enzyme which is upregulated by the triggers that we talked about. It's a fire starter and therefore has more of pathophysiological role. Physiological role include mucosal protection, improving blood flow to the kidney, improving cerebral blood flow and causing platelet aggregation and anti-aggregation, depending upon the need. Whereas the pathological role include macrophages infiltration and mediation of tissue injury and inflammation, including pain sensation. The synthesized prostaglandins act in your body through various types of prostaglandin receptors, which are denoted by the symbol P prefixed with the type of molecule which is acting upon it. For example, prostaglandin E will have EP receptors, whereas prostaglandin F will have FP receptors, and thromboxane will have TP receptor, and prostaglandin D will have DP receptors. All these receptors are G protein coupled receptors, which are mainly of three types: GQ receptors, which tend to increase calcium level and cause contraction; GS receptors, proteins, which act by increasing CAMP level and cause relaxation; and GI coupled receptors, which decrease CAMP and are implicated in various inhibitory activity. The example of GQ receptors are PGE, PGF and thromboxane receptors. This is PGE1, PGF1 and 2. This is PGE2, PGE4, etc. and so on. So the actions mediated by GQ type of receptors include smooth muscle contractions, including contraction of uterus and bronchi, which is mainly the function of PGF, followed by platelet aggregation and vasoconstriction, which is mainly a function of thromboxane A2. GS coupled receptors are involved in vasodilation, which is mainly a function of PGE2, inhibition of platelet aggregation, which is a function of PGI2, and it is the opposite function than that of thromboxane, and sleep regulation, which is a function of PGD2. On the other hand, modulation of pain, allergic response and decreased gastric acid secretion, all these, it's not decreased, rather if you see, it causes increased gastric acid secretion. All these functions are mainly mediated by PGE2 receptors. So after understanding the role of COX-1 and COX-2 and noting down the actions of various receptors, we can classify the physiological and pathophysiological roles of prostaglandins, where the primary role is in the maintenance of gastric mucosal integrity through PGE2 and PGI2, regulation of renal blood flow, that is mainly through PGE2 as well as PGI2, maintenance of patency of ductus arteriosus. Ductus arteriosus, we'll talk about this structure in detail, but remember that this structure is kept open and patent with the help of PGA2, and the process of normal ovulation and uterine contraction where PGE2 is implicated. The ductus arteriosus is a structure which connects the aorta to the pulmonary trunk, and this connection, what it does is it bypasses the blood from the pulmonary trunk into the aorta during the fetal life, as the baby is already getting oxygenated blood from the mother. Only the blood required for the pulmonary development is transported through the pulmonary artery. Remaining blood is sent back to the aorta through this connection of pipe known as ductus arteriosus present between the aorta and the pulmonary trunk. It remains patent during the fetal life because of presence of the prostaglandin in the placental circulation. Now, if you look at the pathological role, the major pathological role of prostaglandin is in the mediation of inflammation, pain and fever, where PGE2 is implicated. In asthma, allergic and other allergic airway disease, where they are responsible for bronchoconstriction, mainly PGF2 alpha, and in dysmenorrhea, where PGF2 alpha causes abnormal bleeding and uterine contraction. Recently, they have found that prostaglandin E2 and COX2 enzyme are implicated in the inflammatory progression of cancer and have become a part of research for development of drugs against it. A very important hemodynamic balance in your body is maintained between thromboxane A2 and PGI2. If you remember from our lecture on serotonin, thromboxane A2 is released along with 5-HT and is responsible for activation of the process of hemostasis by causing platelet aggregation and vasoconstriction by acting on its TP receptor. So this thromboxane A2 is prothrombotic and is a vasoconstrictor molecule. On the other hand, prostacyclin, that is PGI2, is synthesized by the endothelium, and it is an antithrombotic molecule and a potent vasodilator. So this balance is maintained between thromboxane A2 and PGI2 depending upon the need of the body. A drug commonly known as aspirin, which belongs to the class of NSAID, that is non-steroidal anti-inflammatory drugs, can tip this scale. It can irreversibly inhibit the COX1 enzyme by binding to it covalently, by forming a covalent bond, thereby decreasing the level of thromboxane A2, leading to increased prostacyclin activity. Therefore, the pro-aggregatory and anti-aggregatory balances disturbed, and what we get is anti-platelet effect. And therefore, it has been used as an agent for the prophylaxis of stroke and myocardial infarction. There are many analogs of prostaglandins have been synthetically developed and are available in the market for treatment of various diseases. In obstetrics and gynecology, PGE2 analog dinoprostone has been used to target uterus and cervix for cervical ripening and induction of labor. So basically it induces oxytocic action and therefore is a potent labor inducer. Similarly, misoprostol, which is a PGE1 activator analog, can act on EP1 receptors in the uterus and can induce labor. It is also used for the medical termination of pregnancy by inducing early term labor and dislodging the blastocysts. In addition, what is important to note is that these molecules, these prostaglandins, if given for induction of labor, can, especially PGE analogs, they can contribute to fetal heart rate abnormalities. And therefore, when they are used as an inducing agent, they should be used very cautiously. Carboprost is PGF2 alpha analog, and it can cause strong uterine smooth muscle contraction and thereby these contraction of these muscles can impart an external pressure on the uterine blood vessels and thereby cause an external vasoconstriction. Consequently, it is used in the treatment of postpartum hemorrhage. PGI2 analog epoprostenol is shown to have potent vasodilator effect and therefore has been used in the treatment of pulmonary hypertension because it has been shown to radically reduce the pulmonary artery pressure, which can be very high due to any disease. It can be CHF or any other cause. It can be of renal origin also. Similarly, PGE1 analog L-prostadil has been used in the neonatology to maintain the patency of this structure known as ductus arteriosus. As we discussed, it is required if the baby is born with a congenital heart disease where there is no supply of oxygenated blood. The mixing of blood through the ductus arteriosus gives some oxygen level to the baby, and therefore any baby that has to undergo, a newborn which has to undergo surgery or let's say the bypass surgery, in those patients the ductus arteriosus must remain open because it naturally closes after the birth. As the baby cries and the lungs expand, it closes. So to keep it synthetically open, alprostadil is given as a slow IV injection until the surgery is done. The same molecule as alprostadil has also been found to cause local vasodilation in the genitals and has been used to treat erectile dysfunction, though better alternatives are now available. And there is a limited use of these alprostadil in the treatment of erectile dysfunction. As we have seen that PGE1 can increase mucus and bicarbonate secretion and physiologically increase the protective barrier, improve the protective barrier in the GIT. Therefore, PGE1 analog misoprostol has been used in the treatment of peptic ulcer, specifically the peptic ulcer induced by the non-steroidal anti-inflammatory drugs. Because non-steroidal anti-inflammatory drugs are a class of drugs which act by inhibiting enzyme COX-1 as well as COX-2 in some cases, and they halt the endogenous production of all prostaglandin including PGE2 and PGI2. That leads to stripping of the gastric mucosa, which is the biological shield, leading to gastric ulcers. So long-term use of NSAIDs has been shown to cause severe gastric ulcer. Therefore, the NSAID-induced peptic ulcers are generally treated with misoprostol in addition to proton pump inhibitors. PGF2-alpha analogs have also been shown to cause relaxation in the uveosacral pathway and opening of the uveosacral outflow, thereby reducing the intraocular pressure. And that is why they are used in the treatment of open angle glaucoma, where there is no problem in the drainage, rather the outflow has been blocked. The mechanism of action leads to reduced intraocular pressure by improving the uveosacral outflow of aqueous humor. It is very important to note these important side effects associated with this therapy, that some of these molecules are known to cause irreversible brown pigmentation of the iris. They are responsible for lengthening, thickening and darkening of the eyelashes. And it is the reason that bimatoprost has found an off-label use in the cosmetic industry as well. So the other molecules include latanoprost and travoprost. So if we summarize all the drugs that are acting in the body, producing anti-inflammatory effect in the body by blocking the eicosanoids, then there are four classes of drugs. The first class of drugs are corticosteroids. Corticosteroids are strong immunosuppressive as well as anti-inflammatory drugs. and they act by inhibiting the enzyme phospholipase A2. If the phospholipase A2 is blocked, the membrane phospholipids are not converted into arachidonic acid. Thereby, production of all these molecules, including prostaglandin, thromboxane, prostacyclin, and leukotrienes, is blocked. Therefore, they have a broad anti-inflammatory and broad anti-immune or immunosuppressive effect. The second strategy is blockage of enzyme cyclooxygenase, thereby reduction of production of prostaglandins, thromboxane, and prostacyclins, leading to analgesic, antipyretic, and anti-inflammatory effects. The drugs which block them are known as NSAIDs, include painkillers like ibuprofen and drugs like aspirin, which are both painkiller as well as antiplatelet agents, as we have discussed in the previous slide. Also, crocin, a common brand name, includes a molecule known as paracetamol, which also acts by inhibiting COX enzyme, but it has a major effect on your brain, affecting your thermoregulatory center. So therefore it is a poor analgesic but a very good antipyretic, means it can reduce pyrexia or fever very well. This was the second strategy. Third strategy lies on the leukotriene axis, where you can block the enzyme 5-lipoxygenase by a drug xylitol. Leukotrienes are mainly implicated in allergic reactions and bronchoconstriction. Whereas LTB4 has a major role in chemotaxis, that is, the LTB4 attracts the neutrophils and monocytes to the site of injury or inflammation, therefore plays a role in immune activation. Therefore, while xylitol will prevent both immune activation as well as bronchoconstriction, it is mainly used in the treatment of chronic asthma, specifically in children who are not very well responding to beta agonist. And the last class of drugs are the drugs which will block the leukotriene receptors and are known as leukotriene antagonists. And these include drugs like montelukast and zafirlukast. They have been used in the treatment of asthma, mainly chronic asthma, as well as in allergic rhinitis in combination with antihistamines. There is a very important leukotriene axis in the body which is maintaining the chemotaxis and causing potent bronchoconstriction. In some cases, when this arachidonic acid could not be converted into prostaglandins, specifically by the action of NSAIDs, which block the enzyme COX, specifically aspirin, all the arachidonic acid is diverted towards leukotriene axis, and while the aspirin blocks the COX, it forces all cellular arachidonic acid to move down the LOX pathway, thereby increasing the production of leukotriene and triggering a strong bronchoconstriction. This reaction is sometimes seen in susceptible patients who suffer from asthma, and if they are administered NSAIDs or specifically aspirin for their cardiovascular conditions. Therefore, the fourth strategy is leukotriene antagonists. And that is all about prostaglandins, thromboxane, and leukotrienes.